The most common cardiovascular diseases. Cardiovascular diseases are widespread among the adult population of many countries around the world and occupy a leading place in the overall mortality statistics. A person who does not have a medical education should at least generally understand what a particular heart or vascular disease is, so that if you suspect its development, you do not waste precious time, but immediately seek medical help. That is why we offer you this article, which reflects the signs of the most common cardiovascular diseases. Atherosclerosis. Atherosclerosis is a chronic, steadily progressing disease of arteries, mainly large or medium caliber, which is the main cause of the development of various diseases of the heart and blood vessels. This disease has become an epidemic these days, causing about 50% of all deaths. Atherosclerosis begins at a young age and progresses constantly. In people over 60, changes in the vascular wall characteristic of a particular stage of atherosclerosis are present in 100% of cases. Atherosclerosis is caused by a disorder of lipid metabolism in the body. The risk factors for the development of this disease are as follows: non-modifiable, i.e., those that the patient cannot influence, age, women over 55 or younger with early menopause, men over 45, male gender hereditary predisposition, early development of atherosclerosis in close relatives. Modifiable, those that the patient can eliminate if desired, smoking, regardless of the number of cigarettes smoked per day, high blood pressure, above 140/90ths of a millimeter Hg, diabetes mellitus, body mass index over 30, obesity especially abdominal obesity, waist circumference in women over 88 centimeters, in men over 102 centimeters. Partially reversible, changes in biochemical blood test, total cholesterol level in blood over 5.2 mmol/L. Low-density lipoproteins, LDL in the test form, over 4.1 mmol/L or less than 0.9 mmol/L. Other factors: alcohol abuse, physical inactivity, low physical activity, taking oral contraceptives, unfavorable psychosocial environment, social isolation, depression, stress, drinking soft water. Lipid metabolism disorder, expressed in increased cholesterol and triglyceride levels in the blood, triggers a number of pathophysiological mechanisms, which result in damage to the inner lining of the arteries, the endothelium. This leads to platelets adhering to the damaged area, forming an atherosclerotic plaque. This plaque gradually increases in size, increasingly blocking the lumen of the vessel, and the organs that this vessel supplies with blood experience a lack of oxygen. The plaque can rupture, leading to thrombosis, blockage by a blood clot. This mechanism underlies unstable angina, myocardial infarction, and sudden death. Coronary heart disease, CHD. CHD is an extremely important medical problem, since it is characterized by extremely high prevalence and mortality. More than half of the deaths from cardiovascular diseases are due to CHD, coronary heart disease. Every fifth man aged 50 to 59 suffers from this pathology, and the incidence and mortality rates are increasing every year. Coronary heart disease is a disease caused by atherosclerotic lesions of the heart vessels, the coronary arteries, leading to an imbalance between the supply and demand of the heart muscle for oxygen, the development of myocardial ischemia. Factors that increase the risk of developing coronary heart disease, CHD, are main factors: imbalance of lipids in the blood, high blood pressure, smoking, diabetes burdened, heredity, sudden death or myocardial infarction in close relatives before the age of 55 in men and 65 in women. Minor factors: overweight, hormone replacement therapy after early menopause, taking oral contraceptives, psychosocial factors, infectious factors, cytomegalovirus, chlamydia, Helicobacter pylori, alcohol abuse, left ventricular hypertrophy, changes in biochemical blood tests, increased levels of triglycerides, lipoprotein, fibrinogen, homocysteine, procoagulants, the presence of inflammation markers. There are 6 forms of ischemic heart disease, differing in the mechanism of development and characteristics of the clinical course. Sudden coronary death. This form is defined as death that occurs in the presence of witnesses, instantly or within 60 minutes from the onset of acute symptoms, preceded by sudden loss of consciousness. In a healthy person or a sick person who was in satisfactory condition. The main risk factor for this form of coronary heart disease, CHD, is dysfunction of the left ventricle of the heart. Angina pectoris. A form of CHD characterized by attacks of chest pain in response to myocardial ischemia, which occurs due to the impact of factors that provoke it. The main provoking factor is physical activity, both industrial work and household loads, lifting weights, walking outside, climbing stairs. Also, an attack of angina can be provoked by psychoemotional stress, caused not only by negative but also by positive emotions. Less common causes of an attack include sexual intercourse, overeating, exposure to cold, both general and local. Overexertion during bowel movements, if the patient is constipated. If medical assistance is not provided, angina will progress and lead to unstable angina. Unstable angina. This form of coronary heart disease includes newly developed, progressive and post-infarction angina. This is a period of exacerbation of coronary heart disease, characterized by increased severity of pain attacks, and is the leading risk factor for the development of large focal myocardial infarction. Acute myocardial infarction, MI. One of the most formidable cardiovascular diseases and diseases of internal organs in general. It is characterized by extremely high mortality. The incidence of acute MI among men over 40 years of age ranges from 2 to 6 cases per 1,000 people. Every year, about 500,000 people die from this pathology. Myocardial infarction is a condition that occurs as a result of a sudden cessation of coronary blood flow due to thrombosis of a coronary vessel and the development of foci of necrosis, death, in the heart muscle. If emergency care is not provided in a timely manner, and in some cases even if it is provided, the disease ends in the death of the patient. Cardiosclerosis. Morphologically, it is a small area of replacement of the heart muscle tissue with connective tissue. In essence, these are scars. Cardiosclerosis develops after acute diseases of the heart muscle, for example, after a heart attack, or against the background of chronic heart pathology, for example, with myocardial dystrophy. Areas replaced by scar tissue are unable to perform their function and can cause arrhythmia, heart valve defects, chronic heart failure. Painless form of coronary heart disease. Temporary disruption of the blood supply to the myocardium in the absence of signs of angina. During moments of ischemia, in some cases it is possible to register changes in the ECG, electrocardiography, characteristic of coronary heart disease. The risk of acute myocardial infarction or sudden death in people suffering from painless myocardial ischemia is very high, since they are unaware of their disease, and therefore do not attempt to treat it. Arterial hypertension. Constantly elevated blood pressure is one of the most common cardiovascular diseases. It has acquired the proportions of a non-infectious epidemic. Every third adult in the world has high blood pressure, that is, suffers from one of the forms of arterial hypertension. According to the definition of WHO, World Health Organization, arterial hypertension is constantly elevated blood pressure, systolic, above 140 mm Hg, diastolic, above 90 mm Hg. The blood pressure level when making a diagnosis should be determined as the average of 2 or more measurements during at least 2 specialist examinations on different days. Essential hypertension, or hypertension, is high blood pressure in the absence of an obvious reason for its increase. It accounts for about 95% of all cases of arterial hypertension. The main risk factors for this disease are the same factors that contribute to the development of coronary heart disease and atherosclerosis. While the following concomitant pathologies aggravate the course of hypertension: diabetes mellitus, cerebrovascular diseases, ischemic or hemorrhagic strokes, transient ischemic attack, TIA, heart diseases, myocardial infarction, angina pectoris, heart failure, kidney diseases, diabetic nephropathy, chronic renal failure, peripheral arterial diseases, retinal pathology, optic disc edema, hemorrhages, exudates. If a patient suffering from hypertension does not receive therapy that helps lower blood pressure, the disease progresses. Hypertensive crises occur more and more often, which sooner or later can cause all sorts of complications: acute hypertensive encephalopathy, pulmonary edema, myocardial infarction or unstable angina, stroke or transient ischemic attack, arrhythmia, aortic dissection, acute renal failure, eclampsia in pregnant women. Secondary, or symptomatic, arterial hypertension is a persistent increase in blood pressure, the cause of which can be determined. It accounts for only 5% of cases of arterial hypertension. Of the diseases leading to increased pressure, the most frequently diagnosed are kidney tissue damage, adrenal tumors, diseases of the renal arteries and aorta, coarctation, pathology of the central nervous system, brain tumors, encephalitis, polyneuritis, blood diseases, polycythemia, pathology of the thyroid gland, hyperparathyroidism, and other diseases. Complications of this type of arterial hypertension are the same as with hypertension, plus complications of the underlying disease that provoked hypertension. Heart failure, a common pathological condition that is not an independent disease, but is a consequence, an outcome of other acute and chronic heart diseases. With this condition, due to changes in the heart, its pumping function is impaired. The heart is unable to supply all organs and tissues with blood. Complications of heart failure are arrhythmia, congestive pneumonia, thromboembolism, cirrhosis of the liver and liver failure, chronic renal failure, the so-called congestive kidney, cardiac cachexia, exhaustion, cerebrovascular accidents. Acquired heart defects. Acquired heart defects occur in approximately 1 to 10 people per 1,000 population, depending on the region of residence, and account for about 20% of all organic heart lesions. The main cause of acquired heart defects is rheumatic valve disease. 70 to 80% of all defects are caused by mitral valve pathology. The second most common lesion is the aortic valve. Stenosis and/or insufficiency of the tricuspid valve and pulmonary valve are relatively rarely diagnosed. People of different age groups suffer from this pathology. Every second patient with a heart defect requires surgical treatment. The essence of the disease is that, under the influence of etiological factors, the heart valves lose the ability to function normally. Stenosis is a narrowing of the valve, as a result of which it does not pass enough blood, and the organs experience a lack of oxygen, or hypoxia insufficiency. The valve flaps do not close completely, as a result of which blood is thrown from the part of the heart located lower to the part located higher. The result is the same: the organs and tissues of the body do not receive the oxygen they need vitally, and their function is impaired. Complications of heart defects are many conditions, among which the most common are acute pulmonary edema, infectious bronchopulmonary complications, chronic circulatory failure, atrial fibrillation, thromboembolism, and others. Myocarditis. Myocarditis is an inflammatory disease of the heart muscle caused by infection, parasitic or protozoan invasion, physical or chemical factors, or arising from autoimmune allergic diseases, and after heart transplantation. The prevalence of myocarditis is 4 to 11% of cardiovascular diseases. Myocarditis is especially often diagnosed during a control ECG after a viral infection. Clinically, myocarditis manifests itself in attacks of chest pain, signs of valve pathology, symptoms of arrhythmia, and circulatory disorders. It can be asymptomatic. The prognosis for this disease depends on the severity of its course. Mild and moderate forms, as a rule, end with a complete recovery of the patient within 12 months after the onset of the disease, while severe forms can lead to sudden death. Refractory circulatory failure and thromboembolic complications. Cardiomyopathies. Cardiomyopathies are independent, steadily progressing forms of damage to the heart muscle of unclear or controversial etiology. Within 2 years, about 15% of patients die from some forms of this disease in the absence of symptoms, and up to 50% in the presence of symptoms corresponding to the disease. They are the cause of death in 2 to 4% of adults, and are also the main cause of sudden death in young athletes. Probable causes of cardiomyopathies are heredity, infection, metabolic diseases, in particular, glycogenesis deficiency of certain substances in the diet, in particular selenium. Thiamine pathology of the endocrine system, diabetes mellitus, thyrotoxicosis, acromegaly, neuromuscular pathology, muscular dystrophy, exposure to toxic substances, alcohol, drugs, cocaine, some medications, cyclophosphamide, doxorubicin, diseases of the blood system, some types of anemia, thrombocytopenia. Clinically, cardiomyopathy manifests itself in all sorts of symptoms of heart dysfunction: angina attacks, fainting, palpitations, shortness of breath, and heart rhythm disturbances. Cardiomyopathy is especially dangerous due to the increased risk of sudden death. Pericarditis. Pericarditis is an inflammation of the layers of the heart membrane, the pericardium, of infectious or non-infectious etiology. Parts of the pericardium are replaced by fibrous tissue, and exudate accumulates in its cavity. Pericarditis is divided into dry and exudative, acute and chronic. Factors that cause pericarditis are viral or bacterial infection, fungi, parasites, metabolic disorders, renal failure, uremia, heart disease, myocardial infarction. Myocarditis injuries, with damage to the pericardium itself, autoimmune diseases, acute rheumatic fever, rheumatoid arthritis, etc. Clinically manifested by chest pain, shortness of breath, fever, muscle pain, combined with signs of the underlying disease. The most formidable complication of pericarditis is cardiac tamponade, accumulation of fluid, inflammatory or blood, between the pericardial layers, preventing normal contractions of the heart. Infective endocarditis. It is an inflammatory lesion of the valve structures with subsequent spread to other organs and systems, resulting from the introduction of a bacterial infection into the heart structures. This disease is the 4th leading cause of death in patients from infectious pathology. In recent years, the incidence of infective endocarditis has increased significantly, which is associated with a wider spread of cardiac surgeries. It can occur at any age, but most often affects people aged 20 to 50 years. The incidence rate of men and women is approximately 2 to 1. Infective endocarditis is a potentially life-threatening disease, so timely diagnosis, adequate, effective treatment and rapid detection of complications are extremely important to improve the prognosis. Arrhythmias. Heart rhythm disturbances are not separate diseases, but are manifestations or complications of any pathological conditions associated with heart disease or extracardiac pathology. They can be asymptomatic for a long time, or they can pose a danger to the patient's life. There are many types of arrhythmias, but 80% of them are extrasystole and atrial fibrillation. Clinically, arrhythmias are manifested by a feeling of interruptions in the work of the heart, dizziness, shortness of breath, weakness, a feeling of fear and other unpleasant symptoms. Their severe forms can provoke the development of cardiac asthma, pulmonary edema, arrhythmogenic cardiomyopathy or arrhythmic shock, and can also cause sudden death of the patient.